All right, she is the creator of the health clinics that focus on the healthcare professional truck drivers.
How are you?
From Tampa, Florida, Dr. Bethany
All right.
Dixon.
Hi.
Doctor, what's your question?
So I have created a successful brand bringing healthcare to the truck drivers, and I do that with chiropractic care and DOT physicals in the trucking industry. So the advice I'm looking for is I want to scale my business, but I find the clients just really rely on me, and they only want me. And so what do you do with that when they only want you, but you want to help other people?
Well, that's the whole problem with a practice, right?
Right.
And by the way, I am a huge fan of chiropractic. I see a chiropractor twice a week.
Dr. Fab.
I do. Fabrizio Mancini took care of me in Dallas, and Dr. Pat Fabrizio takes care of me here. So
They're amazing.
I got Fabs here, Fab there, Fab everywhere. And my physical therapist is Dave Fabrizio, so I got Fabs everywhere taking care of me. But you know what I really think you have to do, and I'm sounding like a broken record about managing expectations, I think you have to educate patients in the beginning that what you have created are protocols. That what you have created are certain protocols for whether it be back pain, whether it be strengthening the core, whether it be any part of the body that you're rehabilitating. They have to understand that your thumbprint is on everything that is done, and that you work through a lot of different technicians, but that you have your thumbprint on everything. And because I work with these folks that I do, I'm always, and I'm probably their only patient that does this, even though I'm big fans of the ones that take care of me, I have never referred a patient to either one of them. I refer them to their clinics. I refer them to Fabrizio Physical Therapy, or I refer them to Mancini's clinic, and I tell them, look, they have protocols there that they have developed that they progress through. You don't need them in the room, but you need to make sure you have their protocol. And I think the problem is, if you get into a personality-based business, we get caught up sometimes in the income, the social income that comes from being validated by somebody wanting you, and you've got to disengage from that and say, I get all the currency I need from them believing in my protocol. And you really have to rebrand your practice where you're talking about your protocols, your programs, instead of your hands-on. And you can sell that just as well, I promise you, because I've shaped my guys into doing it, and they have been able to leverage themselves 300-400%, and now in multiple clinics. And if you do that, but it's all about mindset going in. You have to brand yourself in a scalable way. If you don't, you work like a babysitter. You hit a ceiling where you have a certain number of hours and you're done. And you can't do that. You want to be able to be making money while you're off doing something else. And then you can market those protocols, whether it's over the internet, through a book, through different things, but you can only do it if you're selling a protocol instead of you and your hands-on personality. You've got to sell the protocol.
Wonderful. Thank you so much for your help.
You bet. Thanks so much.
Thank you.
All right.